Hey everyone, thank you for joining today and welcome to this month's Wellness Wednesday. We'll get started now as people roll in with a quick intro first, and then we'll hand it over to Dr. Zach Walsh afterwards. Okay, so this Wellness Wednesday's topic will be exploring therapeutic cannabis research. My name is Elisa, and I'm one of the program coordinators at the BC Brain Wellness Program, and I will be serving as today's MC for the rest of the event. Before we get started, I would like to first acknowledge that the BC Brain Wellness Program at the Javid Mohajan Center for Brain Health is situated on the traditional, ancestral, and unceded territories of the Musqueam peoples. I'm joining you today from Vancouver, the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. As all of you are joining from different places today, I encourage us all to also take a moment to reflect and give thanks to the lands where we're privileged to work, learn, and play from. We picked today's topic of cannabis research as it is topical given the current landscape and is a common question in clinical settings. We acknowledge the controversy was the topic of cannabis, so please keep in mind that the seminar will be delivered for educational purposes and not as an endorsement for cannabis use. Please note that this session provides a general overview and it's not intended to be used as medical advice. So please consult with your physician when considering cannabis use for therapeutic or medicinal purposes. So today we have invited an expert in the field, a UBC researcher who was awarded the 2020 Researcher of the Year at UBCO. We're fortunate to be joined today by Dr. Zachary Walsh, who will be exploring the potential clinical application of cannabis. Through today's session, we'll discuss evidence-based therapeutic benefits, cannabis modalities, and cannabis's roles in healthy aging and neurocognition. Just a couple of housekeeping notes before we begin. To keep everything streamlined, only the presenters and the MC will be unmuted for today's session, and the chat box is only enabled to be directed to the host and the co-host of this event. So if you have any questions for our presenter today, please type them in the chat box addressed to Alex. She will be facilitating the chat box, and we will answer them towards the end of the session. As well, this session is being recorded and the recording will be available to you on our website at bcbrainwellness.ca in about 2 weeks' time. So if you'd like to rewatch or share with your friends or family, please feel free to do so. And without further ado, I'll introduce our guest, Dr. Zach Walsh. Zach is a clinical psychologist, a professor of psychology at University of British Columbia, and the research affiliate at the BC Centre on Substance Use. Zach is the director of the Therapeutic, Recreational, and Problematic Substance Use Lab at UBC and the head supervisor for the UBC Problematic Substance Use Clinic. He has published and presented widely on topics related to cannabis, mental health, and psychotherapy. He has been the lead investigator for several ongoing studies of the therapeutic use of cannabis, including a clinical trial of cannabis for PTSD and ongoing studies of therapeutic cannabis use among people who use other drugs and the impacts of cannabis legalization. Zach has provided invited consultation on medical cannabis use to the Canadian House of Commons and Senate, the Ukrainian Ministry of Health, and other international organizations. With that, the floor is all yours, Zach. Welcome.
Well, thanks so much, and it's really nice to be here. I'm always so excited to be talking about cannabis because it's really it's my life's work. So I'm thrilled for the opportunity to share some of that with you. And with that in mind, I really appreciate the introduction and the reminder that this is not direct clinical advice. But I'm also not going to stick entirely to just a presentation of the research and try to be unbiased. I mean, I will try to be unbiased, but I also want to share a little bit of my own clinical experience as a clinician and from years of working with patients and just some of my observations and also knowing that I've been working on medical cannabis since well before legalization, and it is a contentious topic as the introduction so nicely framed. So I do come with a perspective, and I don't pretend that it's the only one. So I just want to own that and have everyone keep that in mind, that this is just one perspective, and it's perspective of someone who's been advocating for liberalization of cannabis policies and for further investigation into the therapeutic potential of cannabis. So that's where I'm coming from, just so you know. And a little bit more on that, there is some disclosures. My research overwhelmingly funded by CIHR, by SHRC, by the Tri-Councils, and by my tax, also a little bit by the NFL. I'll talk about that briefly. But I've also received some funding from licensed producers of cannabis. None of it has directly gone into my pocket, but it supported students. I've worked with Tilray and Doja on cannabis research projects, and in both cases, these were before full legalization, and I don't think that there were opportunities to do the research outside of accepting private funding. So I'm not at all conflicted about, I mean, this is a conflict of interest, but I'm not conflicted about having received the funds. I'm grateful that there was some opportunity to ask these questions that so many people want to know, and I'm going to try to answer some of them today. But even now, there is some capacity to receive federal funding for cannabis research that's not exclusively focused on harms, and that has not been my focus. I'm focused on the therapeutic use of cannabis. I'm interested in harms, just as we ought to be when we look at any medicine, but that's not been my focus. And generally, the funding from the Tri-Council agencies throughout the war on drugs has been focused overwhelmingly on harms. That's changing a little bit now, I'm glad to say, and my team and I have been successful in getting CIHR funding for a couple examinations of therapeutic use. But in general, it's a case where the private funding has been a big part of answering the questions that us scientists want to know. I was also a former advisory board member to Indigenous Bloom, which is a cannabis company that was trying to provide opportunities for Indigenous communities to participate in cannabis sale and production. It's another area of interest to me. I am a settler from a mixed Indigenous and settler family. My wife and daughters are married to the Métis Federation. So I have an interest in Indigenous cannabis use and was pleased to work with Indigenous Bloom. I don't want to prolong my conflict, but I think it's worth talking about and not just sort of running past saying it as if it's right. So thank you for your patience as I explained some of that to you. And I'm no longer with Indigenous Bloom. I don't have any stocks in any cannabis companies or anything like that. I'm fairly non-conflicted at the moment, which is nice because the government is starting to fund cannabis research. So I don't need to go to the private sector anymore. But I would again if I had to. I'll do it again. All right. I always want to talk briefly with a little bit of history. Because, when we talk about medical cannabis, it's almost the feeling can be that, oh, this is new. Well, cannabis is a medicine now. Medical cannabis is cannabis. I look forward to the day when, first of all, nobody knows what marijuana was because it's such a wrong-headed descriptor for this multi-purpose plant. So cannabis is good, marijuana not so much. And also the medical preface that I think is still useful. But if we look at the history, the thousands of years of history, the 5,000 or so years of history, the recorded history anyways of the co-existence and perhaps even allyship between humans and cannabis, I think the history really emphasizes this as a medicine as opposed to a recreational drug. As with so many medicines, the dose, of course, is the poison is in the dose. So with many things that are primarily medicines, they can be misused, but I guess what I'm getting at is I don't think that medical use is the exception. I think that most cannabis use is likely medicinal in intent. And when we get back to some kind of baseline away from this history and this horribly wrong-headed war on drugs and our misunderstanding of cannabis, my hope is that it will once again be seen primarily as a medication that can also be used perhaps for recreation or spirituality or whatever, but that we don't need to really emphasize that it's a medicine because that will almost go without saying. And this history is very old. It's maybe one of the oldest medicines. Well, it's certainly one of the oldest medicines. It may be the oldest. I don't think we'll ever really determine that, between cannabis and opium. But one of the oldest cultivated plants, our first recorded history of it goes back to Central Asia, what's now China, and sort of a legendary figure, Shen Nung, who's also attributed with the discovery of tea, and just highlighting this ancient history of cannabis. It's hard to know really much about cannabis use in China today. I think it's an under-researched topic. If anybody knows much about it, I would sure love to hear more. It's hard to know what levels of use there are, but certainly that there's a long history there. In terms of locations where we have more of an unbroken chain, we really want to look at the oldest continuous use of cannabis as a medicine. We go to India, where still used to this day, and the term ganja refers to the buds. And interestingly, many of you probably associate ganja with Jamaica and maybe Rastafarian culture. Reggae music refers to it as ganja, but that is because of immigration from India under British colonial rule. So these customs were taken from India and transplanted to Jamaica, where they use the term ganja, which is of Indian origin. And in many of the old medical texts, very ancient in India, the Ayurvedic medicine traditions, and in the Vedas as well, we hear cannabis referred to widely, and it's still used very widely in certain celebrations, particularly Halloween. Fast forwarding to Europe, we have the transfer of this medical knowledge came from India to Europe via primarily through England, although there's a lot of early stuff in France as well. Through a fellow named O'Shaughnessy, a British physician who was located in India and started to take a serious look at the use of these cannabinoid medicines, found its way. And of course, I'm giving you a very brief history. There's a lot of rich history here that I encourage you to research if this kind of thing interests you. But one of the more prominent early users of cannabis in England was Queen Victoria. But she was not alone. In Victorian England, so many over-the-counter medications would have had cannabis in them. And the same is true in the US and Canada up until about the 1920s. It was one of the main ingredients in so many medicines. And part of the reason for the rebranding of cannabis as marijuana was to alienate it from that medical history and make it seem to facilitate the stigmatization and demonization of the plant and associate it with the racist ideologies that were trying to fearmonger around immigration from Mexico. So that's why it was given a Spanish name and associated with Mexican immigration. And the war on drugs is, of course, ultimately a racist war, and the potential use of cannabis has been impeded by that. And I think one of the nice things as we're starting to gain a sensible drug policy is to see that this isn't based on fact, the fear about cannabis. It's really based on values that I think few of us, if they're made explicit, would really feel comfortable upholding. So the paranoia about cannabis is really hard to separate from racist fear-mongering. So there's the background. I'll get off my soapbox for a moment now and try to share with you some of the scientific literature. There's so much that we could focus on, and I do want to leave time for questions and also finish at one. So I'm gonna move quickly. I know this is brain wellness and brain health, so I want to talk a little bit about the history of cannabis or the potential of cannabis directly in brain injury. I'll also talk a little bit about mental health and sleep. And also about substitution for other medicines, because I think that's so important. But when it comes to brain injury, and that picture there's of Raphael Mechoulam, someone who I'm hoping will receive a Nobel Prize before he passes away. I think he must be about 90 now, and he discovered THC, and he discovered the cannabinoid receptors in the brain, and he discovered the endocannabinoid system. Really tremendous contributions to science, to health science. And what he notices is that there's these endocannabinoids. So the reason cannabis works, the plant-based cannabis works, is because it contains molecules that are very similar to molecules we have in our own brain. We have our own cannabis system inside our body called the endocannabinoid system, where we make our own molecules that look a lot like THC, and that's why we have receptors for THC that bind so regularly. So we produce our own endocannabinoids, the most common of which are anandamide and 2-AG, also 2-arachidinol glycerol. And one of the things that's noted in this 20-year-old article is that at the time of brain injury, we see a huge uptick in the natural synthesis of these endocannabinoids, and they seem to have an anti-inflammatory and neuroprotective effects. So of course the question becomes then, if our own naturally produced cannabinoids can have protective effects for brain injury, what is the potential for administering plant-based cannabinoids or cannabis extracts, most likely, in a similar situation? And I wish I could tell you that we have tested all this and indeed we do, but I think it's still largely hypothetical. And I'll talk to you a little bit about some of the research we're doing to try to clarify that. So, jump forward 20 years, and we have this from the Canadian Journal of Neurological Sciences. So this is recent, this is post legalization. What we see is that a lot of folks with traumatic brain injury, based on anecdote and hypothesis, drawn from some of the things that I just mentioned, a lot of people are trying cannabis products to address the consequences of TBI, but there isn't a lot of empirical literature to speak to that. There certainly aren't the randomized controlled trial that we would love to see. So it just calls for more research. You'll hear that again and again when we talk about cannabis. We need more research. And it started right with my conflict disclosure that we need more funding and more research and more people at the table, because the research has really been slowed by these years of prohibition. And what we're dealing with is really, I think, a tremendous medicine that has thousands of years of human use in history, and we're just starting to uncover it. So it's a very exciting time to be a scientist in this area, but also frustrating when we think of how many unanswered questions that we really should have answered by now. And to that end, I'm glad to be involved in a study that has just started out now from the NFL. Working with a team out of University of Regina. Patrick Neary's leading it, looking at what happens if we administer cannabinoids, mostly CBD, but they're also going to look at THC, to athletes who undergo concussion. So one of the thinking is that part of this anti-inflammatory effect, we need to be able to apply the cannabinoid therapies acutely subsequent to injury. So we're looking at that in a variety of populations, and hopefully this will be some pretty leading work. The NFL is pretty conservative in terms of their funding, so it's exciting to be able to get this funding. I also want to talk about some of the risks, and this is really, I think, the meat of my presentation is talking about cannabis substitution. So we can talk about cannabis on its own as a medicine. We can talk about these various conditions and how effective cannabis is or isn't. But I think we miss a lot of the potential health benefits of cannabis if we don't look at it in the context of use of other medicines. And that's where a lot of my research has been focused on, is using cannabis as a substitute for more dangerous medicines, mostly opioids and benzodiazepines, but also alcohol, not a medicine, but a recreational drug. And in the case of TBI, traumatic brain injury, and I work with a lot of problematic substance using populations, some marginalized, unhoused, complex people who are struggling with a variety of issues. Largely, the big risk for them is opioid overdose and poisoning. And so many of those individuals are also suffering with traumatic brain injury. And we see this terrible cascade of effects when it comes to that combination of problematic substance use and traumatic brain injury. And so many people that we see that are really suffering out in the streets of Vancouver and Kelowna and all across North America really are not only experiencing problematic substance use, but also brain injury. So we have to look at how can we start to address these concurrent issues, and is there something we can do? We could say, people should go unmedicated. And that would be better than opioids. And in many cases, it might be in terms of their mortality, but is that realistic? And if being unmedicated is not realistic, then what are some alternatives, some compassionate alternatives for people who are suffering with a variety of symptoms but the medicines they might be using to address them are not effective. So looking at cannabis as a substitute, I think has a lot of promise and is a very important way of thinking about cannabis and health. And when you look at some of the research that we did, and this is also going on 10 years old, but it still stands today. Why do people use cannabis for medical purposes? Overwhelmingly, they use it to help with sleep. And I want to talk about that. I know that, troubles with sleep are not only for individuals with diagnosed mental health conditions, they're comorbid with so many things, and such an exacerbating factor in so much disease. So, it's hard to feel better if you can't get a good night's sleep, and there's so many conditions that interfere with that. So anything that can help with sleep is great. And that's what we see a lot of people using cannabis for. The other one is chronic pain. That's what people, that's one of the number one complaints why people go see a doctor, because things hurt. So if we can address pain, that can be really helpful. And then the other ones are really anxiety and depression. And I'm going to talk a little bit about all of those, because I think they're important for understanding the whole puzzle of cannabis as a potential medicine. And I seem to be turning my slides around every time. So just to give you an overview of what we know about mental health, this is a guided systematic review that we did a few years back. Probably time for an update. I think we're about five years now, but this gives you a pretty good sense of what the literature was, at least around 2016 or so. And what we did here is a comprehensive review of everything that's looked at therapeutic cannabis use. And we also tried to look a little bit at some of the non-medical literature. There's a lot of problems with the non-medical cannabis use literature. It's very focused on problems. It often doesn't control for important variables. And it is being conducted in context, and this is probably the most important piece, being conducted in context where cannabis is illegal. So when you're looking at people who use cannabis medically, non-medically, we're looking at people who are also, in many cases, breaking the law. Maybe breaking an unjust law, but nonetheless, they are breaking the law, and that is associated with a number of risk factors in and of itself. So it's really hard to tease apart the therapeutic benefits of cannabis unless you're looking at people who are explicitly using it with therapeutic allowance. So people who have some kind of authorization to use it. Otherwise, it's very hard to make sense of the literature. Nonetheless, there's a lot of it out there, so we want to see if there's any signals that we can get that are meaningful. And we looked at anxiety, and this is one of the main reasons why people use cannabis medically. And we had 8 cross-sectional studies of medical users, all of which report anxiety as a primary or secondary benefit of their cannabis use. So that's a big motivation for cannabis use. And in one of these studies, the only one of them that looked at people stopping cannabis use, and it reported the anxiety returned. And I think that returns us to an important theme about medical cannabis, is that it in many cases, or in most cases, I would even say, it's not curative. It is for symptom management. It reduces the symptoms of pain, sleeplessness, anxiety, and depression. But when you stop using cannabis, the symptoms will return. And a lot of medicines are like that. Band-aids can be a good thing, but it is ultimately a band-aid. My hope for a more broader, lasting health advantage of cannabis is for people who struggle with mental health and sleep, particularly, that if you're able to manage the symptoms more effectively, it can lead to a higher quality of life and perhaps engagement in activities, behavioral interventions, exercise, etc., things that are going to lead to a more sustainable drug-free recovery. So hopefully it can be sort of a ladder out that lets people regain a normal life and recover that way. So I think it can have more lasting effects, but the acute effects of cannabis are that. They're acute effects. In our review of the non-medical literature, we see a small positive association between cannabis use and anxiety, but of course we would see that if people are using it to treat anxiety. If you were to look at a study of levels of anxiety in people who take any anti-anxiety medication, you would see that they have higher levels of anxiety. That's why they're using the medication. So it's very hard to interpret those population level results without knowing the people's intention and not knowing how the cannabis is affecting their anxiety. Just telling you that they have higher baseline anxiety, that does make sense, but whether it's often implied that the cannabis causes that, but really, I think it's probably more parsimonious to suggest that people are using cannabis to address their anxiety. And the same goes with depression. We see, for those of you, and it's nice to be in a legalization environment. We're still one of the few countries, amazingly, where adults can choose to use cannabis. In those, so I don't have to be all nudge, nudge, wink, wink. I assume that many of you have tried cannabis, and you may have noticed, if you have, that it has an effect on your mood, a positive one. It reduces negative mood. So we shouldn't be surprised that in these studies of therapeutic use, and many people who have chronic illness also have decreasing mood. They're not able to do many of the things that they used to do to make them happy and keep them busy. So mood improvement is a nice thing if it can be there. When I think about some of the potential concerns that I have about that, is the possibility that perhaps for some folks, cannabis could keep you at a place where your level of distress is tolerable, and in that way you will be inhibited from seeking more longer lasting treatments. So maybe cannabis just keeps you at that marginal level, and you don't go and really dig in for those kind of behavioral treatments that are going to help you work through depression. But in general, something that can improve mood, I think, is helpful. And when we look at something like SSRIs that are increasingly being demonstrated to have all sorts of problems in terms of their risk benefit ratio, with cannabis, there is a withdrawal, but much easier to stop when you don't want it than it is with SSRIs. So we widely use SSRIs for depression, even though they're not terribly effective. And in many cases, they have negative sexual side effects and weight gain and all kinds of negative side effects. But for some reason, they're not stigmatized, whereas using cannabis to improve your mood does seem to bear more of a stigma. In the non-medical literature, we see the same thing as what we see from anxiety. A positive association. People who use cannabis have a bit more depression. Is it because of the cannabis, or are they smoking cannabis because they're depressed? Tough to say. My inclination is to think that people are using it to treat their depression, not the other way around. PTSD, I don't want to go into this in detail, but it's an area where there's perhaps some of the best evidence for cannabis, just because of the symptom clusters. We know that there is certainly a role for the endocannabinoid system in the response to trauma and recovery. And many veterans use cannabis for dealing with post-traumatic stress disorder symptoms, particularly nightmares. Talk about that in a moment when we get to sleep. But I also want to highlight that none of this research, and indeed what I see as a very positive move towards legalizing cannabis and liberalizing access to cannabis as a medicine, this has been driven by courageous patients and courageous providers who are willing to risk their reputations and risk their livelihoods in order to deliver this, what they see as an effective medicine to people in need. And we wouldn't be anywhere if it wasn't for the advocacy of medical cannabis patients and providers. So I just always feel that I would like to highlight that as we move away from some of those pinnacle moments. We want to remember the people who got us here, and it wasn't cannabis researchers like me. It was the patients who were taking the risks and the people who were running the dispensaries. And we talk now about the illegal market and getting rid of the illegal market, but in many cases, those people deserve commendations for their courageous acts of civil disobedience that got us to a better place. And nowhere is this more evident than in the veterans movement to provide cannabis for PTSD. And a study from our group that I think is worth mentioning highlights that, and we see this more and more in studies of cannabis, that the PTSD stays with people even though they use cannabis. It doesn't necessarily resolve the PTSD, but it improves their quality of life. So in this case, we see no difference in PTSD among those who use cannabis and don't, but the people with PTSD who use cannabis had lower levels of depression and suicidal ideation. And suicide is such a serious concern when it comes to post-traumatic stress disorder that if we're able to reduce suicidal ideation in individuals with PTSD, I think that's a really big win. I'll talk briefly about moving now into pain, and I think the concurrence of mental health and pain, because I think that's probably of interest to many of you in the audience. This study looked at individuals who are suffering from arthritis, and there's a partnership with the Arthritis Consumers Experts Group and the Arthritis Research Center. And what we found, one nice thing about this study is we looked at people who are using several treatments for their arthritis-related pain. And we asked them to compare, how did they find that these different treatments stacked up? And if you look at directly reducing pain, you see that cannabis compared to non-steroidal anti-inflammatory drugs, the NSAIDs, as I've got them up there, those are things like Tylenol, aspirin, Advil, ibuprofen, widely used non-opioid pain medicines. When it comes to directly, and also opioids in this sample, we see that when it comes to directly reducing the pain, there's not much difference. Cannabis outperforms the NSAIDs in terms of making it less bearable, less irritating. But what we really see is the most pronounced difference where cannabis outperformed both opioids and non-steroidal anti-inflammatories, keeping in mind this is self-report in a relatively small sample, but nonetheless, in being less depressed about pain. So it could be that cannabis has a couple different mechanisms of action, and keep this in mind as if you're considering self-treating with cannabis, is that it may not be directly reducing the pain, although it does have anti-inflammatory or can have anti-inflammatory effects, but it is in the perception of the pain. So it may be that it's making people less depressed about the pain, less focused on the pain, distracting from the pain. So it's the experience of pain that is altered, not necessarily the pain per se, although the experience of pain is pain. So it's a tough one to say, but it seems to be some of this attitude and acceptance of pain that is facilitated by cannabis rather than a direct analgesic effect. And one real benefit of cannabis, if it does help with pain, if it is comparable with opioids, is that perhaps people would stop using their opioids. And in fact, we know that chronic pain, depression, and anxiety go together. So for many people with chronic pain, they're using some kind of antidepressant, as well as maybe an NSAID or an opioid, or maybe all three. So one potential, I think, of cannabis is that it could replace a few medicines in your medicine cabinet. Perhaps it can deal with both mood and pain concurrently. And when we take a closer look at this subsample from this study, this is of people who are using cannabis primarily for mental health. What are they substituting it for? They are 20% of the mental health sample we're substituting cannabis for opioids, and also substantially for benzodiazepines. So, it does look like people who are struggling with mental health are also using cannabis to deal with pain, and perhaps people are using it primarily with pain, or also using it to help with sleep and anxiety, as such, potentially reducing their dependence on benzodiazepine medicines. And of course, I cannot overstate, we're here in presenting here from BC, and I think I'm as it's coming to me now that I may have neglected telling you all that I am coming to you not from Vancouver, where we had a lovely land acknowledgement, but I'm in Kelowna on the unceded territory of the Seal Okanagan people who have been stewards of this land since time immemorial. And here in the interior of BC, as on the coast, we have a terrible problem with overdose. And it's the opioid overdose emergency, but really, if we're going to be specific about it, it's part of a broader profile of overdose that often includes opioids, but may have stimulants and benzodiazepines as well. Regardless of that, what we know is this is an unprecedented health crisis. I use this somewhat out of date infographic because what it shows, what I think is interesting, is that although for this first half of the year we have the 742 deaths from overdose, those are accompanied by over 6,000 ambulance calls. So we tend to talk about the mortality, and understandably so, but know that each of those are also accompanied by huge other health problems that don't necessarily lead to a fatality, but still take up a lot of resources, and perhaps may lead people with cognitive problems that come from overdose. And we get back to that brain injury and addiction spiral that is going to be something that we're going to be dealing with as a health issue for the foreseeable future. Even if we are able to find a way out of this opioid overdose crisis, we are still going to be dealing with people who have chronic illness as a result of it for the foreseeable future. So we need to look at alternative medicines, and I think cannabis has a role to play. And looking at this, we see it's just getting worse and worse. And I don't think that cannabis is the answer. These recent statistics are just appalling. over 2,000 deaths a year. Unbelievable. And it doesn't seem to be getting better. So we need to look at everything we can to address this problem. And as I said, I don't think cannabis is the answer in and of itself, but I think it could be part of it. And when things are this bad, something that can help a little bit can ultimately have a big consequence. And to that end, we've done a lot of research on this area, looking at primarily cohorts of people who use drugs, in this case, injection drugs, largely on the downtown east side. And what we see in this study is that daily cannabis use was associated with reductions, increased likelihood of stopping injection drug use or injecting opioids. So some evidence for substitution there. We've also got similar findings from crack cocaine. People are using cannabis to help them get off crack. And going back to the injection, because we know that the onset of injection drug use is such a dangerous inflection point, is that in young adults, it seems that regular cannabis use is associated with a lower rate of initiating injection drug use. And so, there's been a long history of people saying that cannabis is an entry drug, a gateway drug, but what we're finding more and more is it's a gateway out, and perhaps may have protective effects amongst people who are already using drugs to stop them from transitioning to harder drugs. And I think this one is very interesting because it gets right at that issue of chronic pain and cannabis use and opioid use, and people who use cannabis every day had a 50% lower use of using illicit opioids every day. So again, we're seeing a protective effect of cannabis in the context of this opioid overdose epidemic. And it's not just opioids, as I said earlier, benzodiazepines are increasingly being found in high concentrations across BC, and they're complicating our attempts to reverse overdose and just generally increasing the mortality. It's not only for highly marginalized, high-risk individuals. For many people who are overdosing in other contexts, it is that combination of benzodiazepines and opioids. And so if we're able to reduce both of those, that's a big potential benefit of cannabinoid medicines. And so we also see in some diverse research that cannabis can be used as a potential substitute for benzodiazepines. So this is recent research, again, showing, in this case, 45% of patients were able to discontinue benzodiazepines for cannabis. And, we can argue about which is preferable. I think but what I do think is important is that people be aware that there is that potential to explore substituting cannabis for benzos. And I think that could be a personal choice that a reasonable person should be able to make. There are lots of things to like and dislike about both medications, but I don't think that one is clearly better. I personally, for myself and for my loved ones, would recommend trying a small dose of cannabis for sleep before I would start going down the pathway of benzodiazepines. But reasonable minds can differ, and I'm a clinical psychologist. I'm not a medical doctor, so but I know doctors who would prefer cannabis to benzos as well. Real doctors, psychologists, doctors. And I don't want to get too much into alcohol, but that's still the major cause of injury and disability when it comes to drug use. And what we found, at least in our undergraduate students, is that unlike something like cocaine that increases alcohol use, cannabis seems to decrease it. So over half reported drinking less alcohol when using cannabis, and 1 in 10 are purposely using cannabis to reduce alcohol consumption. So really taking a harm reduction approach with cannabis when it comes to binge drinking. And this is I always like to present some up and coming research. So this is from a recent dissertation of one of my graduate students. We're preparing this for publication. It's not out yet. And what this shows is that if people used cannabis before a binge, they drank about a half a drink less, which is a big deal. It's on average, so it's not like they just drank half a drink and put it down at the end. In general, people drank less. And when we get into binge drinking, each drink, the risk of accident and negative consequences increases exponentially with each drink. So if people drink even just one drink less in a binge, that's a big deal. I'm going to pivot for our final moments in this presentation now to talk a little bit about some things that I think might be of particular interest to older adults. And that is the effects on cognitive functioning. So we're all very worried about the negative effects of cannabis. I talked a lot about the positive ones, but what are some of the negative effects? And one of them, at least in the lore, is that cannabis makes you cognitively impaired. However, some recent studies kind of are challenging them. In this one study from the group at Harvard, it's a small study of medical cannabis patients, but it found that they had improved executive functioning in some cases, and in some cases no deficit, and mostly no deficits. And the authors didn't credit that with the direct effects of cannabis, but rather that it's due to symptom reduction. So if you're getting a good sleep and you're not in distracting levels of pain, you can do better on some of these cognitive tasks. We also found, so the other thing is, does cannabis change your brain in a negative way? And there's been some evidence that it does. However, in this recent report from Addiction, which is the top journal really that looks at substance use, whereas alcohol showed large clusters of negative association with brain volume, what we see is no observed differences in structural measures and cannabis users. So it doesn't seem to change the brain, at least not as much as alcohol and some other drugs. And when you look at midlife adults, this recent study also, within the last 10 years, and I think probably the most comprehensive longitudinal examination of cannabis use in midlife adults showed no acceleration of cognitive decline. And so there, I think that with the stigmatization of cannabis and some of the problems in looking at the effects of illegal cannabis, the newer research is showing that there's far less reason to be concerned about lasting cognitive decline associated with cannabis use. And what we are noticing is with legalization, we haven't really seen a big increase in cannabis use at all. In fact, it's really a lovely finding, but it seems like there may be even some modest decreases amongst adolescents who are using cannabis now that it's legal. But there is one group that is using a lot more cannabis, and that is older adults. And we don't know much. So as with so many things, we need additional research, but there's no smoking gun or a particular reason for concern that we've identified yet. Just that, boy, older adults are using cannabis at a much higher rate than they were before. And what does that mean? If older adults are using it to reduce their use of benzodiazepines, which have been more robustly associated with dementia and cognitive decline than cannabis has, maybe it's a real benefit. If they're using it to reduce opioids, also a potential benefit. If they were just fine and they're starting to use cannabis out of the blue, well, maybe that's not the best thing. Another obvious problem, since you're smoking it, and again, if I had more time, I would go into different modalities. You don't need to smoke cannabis. There's lots of options for ingesting it orally that don't have that potential irritation to the throat and lungs. But what it was really heartening is that cannabis does not appear to have the negative effects on the lungs at all that tobacco does. So, I remember when these results came out, and many of us in the medical cannabis research community were so relieved, because I think based on what we knew from tobacco, we almost assumed that there was going to be some problem with pulmonary function, and there's nothing. In summary, and just to read this one, this is from Donald Tashkin, who's one of the pulmonary experts of the world at UCLA. The cumulative evidence implies far lower risk of pulmonary complications of even regular heavy marijuana use compared to the grave pulmonary consequences of tobacco. So yes, you probably shouldn't smoke it, better to eat it, but it's not like smoking tobacco. One problem that is real, that there's no doubt, if you smoke cannabis regularly, you will develop tolerance and withdrawal. So that is a problem. Certainly, I would say, comparable perhaps to caffeine withdrawal. It's easier to manage, certainly, than opioid withdrawal or withdrawal from SSRI antidepressants or withdrawal from tobacco. But I would say, just anecdotally comparable to caffeine withdrawal. You have a couple uncomfortable days, maybe a little easier than caffeine withdrawal. I know there have been times where I've quit both at different times, and getting off. I don't know if I've ever successfully really quit coffee. I've cut down, but I have coffee right here. I have no cannabis or anything. I don't have a joint burning in the ashtray as I give you this, but there's no inhibition about having a coffee right here. Also an addictive drug, just for the sake of context. So what are the symptoms of cannabis withdrawal? The number one is craving, irritability, and sleep disturbance. And this is a nice open access article if you want to get into it in detail. But you can see most of the withdrawal symptoms resolve within 2 weeks, with around 2 to 5 days being the worst part. Craving, restlessness, nervousness, sleeplessness is a big one. Similar to benzodiazepines, if you rely on cannabis for sleep and then you stop, your sleep is going to be disturbed, mostly through what's called a REM rebound. So what do we know about endocannabinoids and sleep? And I'll go through this quickly because I want to leave some time for questions. We know that endocannabinoids, those naturally occurring cannabinoids, are very important in sleep. We know that using cannabinoid drugs alters sleep. It decreases sleep onset latency, so you get to sleep faster. You're less likely to wake up once you fall asleep. And we increase slow wave sleep, but decrease REM sleep. REM sleep is the dreaming time of sleep. When you inhibit REM, which is what you see with alcohol, with benzodiazepines, and with cannabis, when you stop using those drugs, you tend to get REM rebound, which leads to disturbing and vivid dreams that can cause sleep disturbance. So something to look out for if you're using cannabis for sleep is that when you stop, you may have some trouble getting to sleep. And as I said, like benzodiazepines, or so many people use alcohol type of sleep, which is really very bad, ineffective medicine for sleep. So, this theme of substitution keeps coming up again. If you're using cannabis and decreasing other medications, that's, something that you can make a personal choice about. If you're using it and you weren't using medicine before, then that's something you want to weigh. You will get rapid tolerance if you use it regularly. And when you stop, you'll get less sleep time, less efficient sleep, longer to get to sleep. So all the good stuff that happens with your sleep when you use cannabis, the reverse happens when you stop. What do we know about cannabis as an actual medication that physicians are recommending for sleep? Well, there is no indication for cannabinoid sleep medicine. There's no way your doctor can officially prescribe cannabinoid medicines for sleep. Having said that, 85% of people who are using medical cannabis are using it to help with sleep. And the studies are flawed. It's incredible that we don't have better evidence, but we really don't. There's a few studies going on, but I don't think there's anything definitive that's going to tell us, hey, is this something that we should be using for sleep? And how does it chalk up to other things in RCTs? We just don't know. I'm hopeful that we'll know more in a decade, but I also said that a decade ago, so I'm less hopeful than I was when I said it a decade ago. So, is the case with most cannabinoid medicines. Again, this isn't a forum for getting medical advice, but what a lot of physicians will say is start low and go slow. So start with the smallest dose and increase until you get the effect that you want, but increase slowly. And if it works, then you can weigh the costs and benefits. And if it doesn't work for you, you can leave it alone. That's unfortunately where we are at with medical cannabis. More research is needed on what's the appropriate dose. Is it CBD? Is it THC? Is it a combination? And if we had more time, I could go into those subcomponents of cannabis as well. But for now, just the summary that there's a clear role of the endocannabinoid system. Sleep disturbance is a common reason for using. It can help other disorders improve if you get a good sleep. I didn't get into it too much in the case of PTSD, but cannabis can really help with nightmares. And I guess hopefully the future decades will see. But in the meantime, it is an available substance in Canada that many people are trying out to help with their sleep disorder. And as I speak with cannabis clinicians, I was talking to someone the other day who's a doctor who does a lot of cannabis prescribing. He says since legalization, that's his only, really the vast majority of his practice is people 65 and older who are looking into cannabis as a sleep aid. And that is it for my presentation today. I've got a few minutes for a few questions. These are the graduate students who did all the hard work that lets me give these presentations to all of you. So much thanks to them. There's my email. If you ever have any questions, don't hesitate to reach out. I'm easy to find on the internet. If you lose this email, just try to remember my name and that I'm at UBC and find me that way. And thank you so much for your attention. I'll stop sharing my screen and take a few questions.
Great. Thank you so much for sharing your expertise on therapeutic cannabis use with us, Zach. It was really informative to learn about the evidence-based cannabis use and the different areas that can be benefit through these uses. We do have a few questions from the audience, so we'll kind of dive into that. So the first one, this person's been seeing claims that cannabis products, particularly CBD, has almost no side effects and no drug interactions. Does the research support this?
CBD is such a mystery. There do seem to be some interaction with liver enzymes. I don't think I'm the best person to talk about that. Compared to most other medications that are on the market, it is remarkably safe. The side effects of CBD, from my understanding, are minimal. See, when I say CBD is so mysterious, we really have no idea. It really is mysterious in the way that we don't really know what's even an adequate dose. It's really about, and everyone, I said we have this endocannabinoid system. So it could be that the best way to use cannabis really depends on the individual differences in your own endocannabinoid system. And maybe it's not something where we're going to get a really good standardized dose. But for me, now it's really curious that we aren't able to provide any kind of meaningful guidance around dosing. So I really do wonder about CBD. With THC high products, certainly the dose is self-titrated. So you're able to feel it as it comes on, and people, after a little bit of self-experimentation, which is why I say start low and go slow, are able to identify a dose that provides them with symptom relief. And often it's helpful to work with your physician to really specify what that is and to know what to look for. But it's the kind of thing where certainly there are side effects, the cognitive effects, the high, some people would call that the side effect. But one of the benefits of that is you know when you're getting enough. So those are side effects. Certainly there's a cognitive interference where you don't feel, you may be still be intelligent and still be able to function, but you're altered. So that's a side effect. I don't know if that gets it. There's nothing that's super unexpected that you'd be very worried about. I think for young adults, there's a concern about potential psychotic disorder. So if you have a history of psychotic disorder or a first-degree relative with psychotic disorder like schizophrenia or bipolar with psychotic features, in those cases, I think there's a reason to be cautious.
Great, thank you. And on a similar topic about difference between CBD and THC, this person's wondering, for people using cannabis specifically for anxiety and depression, are they using more of one or the other?
That's a great question. As I said, there's so much mystery around CBD. The wisdom for a long time was that CBD mitigated some of the negative effects of THC. So it was less cognitively impairing and perhaps less likely to cause some kind of anxiety. There's this paradoxical thing with cannabis where it reduces anxiety, but can also cause anxiety. But in the last year or so, there's been a couple of new studies that have come out that draw that into question. So unfortunately, though, it's one of those things where the more you know, the less you know when it comes to CBD. So yeah, 2 studies just came out in the last year showing that CBD actually seemed to increase impairment with THC versus THC alone. And another one showing no difference. Prior to that, there were some studies suggesting that CBD was antipsychotic and reduced some of those cognitive effects of THC. I think it may be a case where people have to explore for themselves how the different types of cannabis impact them. And what I found in working with patients is that people will often find a specific chemovar, or what they're calling a strain, or just a type of cannabis that really works for them. And there's a lot more than just THC and CBD in cannabis, although they're in pretty low levels. There's a bunch of other cannabinoids and terpenes that could be having an effect. So there's a lot of mystery out there, and it's really hard to recommend THC CBD ratios with any kind of confidence, even though if you go into a dispensary, people will tell you for sure this does this, this does that, but that's because they know less, not more, unfortunately.
Great, thank you. Just kind of switching the topic, there's a question regarding stigma associated with cannabis use to manage the various symptoms. So while this seems to be lessening, the stigma from like health professionals and friends may prevent people from trying it. Do you have any tips for managing this feeling of stigma?
Yes, it's a real shame. It's been something sort of a focus of my career, trying to counter that stigma, because I think it's totally unproductive. So if you're going to speak with your physician about cannabis, which I encourage you to do, if you're using cannabis medicinally, your doctor should know about it and should be able to guide you, or at least know if they don't know, and then she can direct you to someone who does know more, and you can have a meaningful and detailed, thoughtful conversation around your cannabis use the way you would with any other medicine. Unfortunately, in many cases, that is not the case due to limitations in medical education. Many doctors are not aware of the true medical potential of cannabinoids. They've been taught, they've been misinformed, and as much as we'd love for them to re-inform themselves, they have not all done them. So if you have an unreformed physician who still doesn't know the latest on cannabis, I would say arm yourself with literature regarding the condition that you want to discuss with your physician. And be prepared to have to address this unreasonable stigma. It's a shame that you have to do that, but unfortunately, we're still living in the with the consequences of the war on drugs. And it's physician stigma and lack of access to good medicines like cannabis and psilocybin is part of the war on drugs. The overdose epidemic and the just carnage that we're seeing on our streets is another consequence of the war on drugs. So yeah, we're still trying to recover.
Great, thank you. The next question we have is there any research being done about the emergence of paranoid delusions after long-term use or abuse of cannabis? And does this delusional behavior originate from the same area of the brain as paranoid schizophrenia, if such brain region exists?
Yes, good question, complex question. I don't know. I think that, with the enthusiasm for brain science, I think, and I'm saying this in the brain wellness, I think there's a lot more, when we talk about emphasis on different brain regions and on understanding the mechanisms of mental health and attributing to a certain region, I think that a lot of the time our theorizing tends to get ahead of the evidence. So I don't know if there's a brain region. I think things like psychotic disorder and schizophrenia are very complicated and emerge from a variety of different suboptimal functioning in a variety of brain regions, and are also embedded in a socio-cultural context. So there's a lot of ways we can understand them, and I don't think it's one brain region that it emanates from. Having said that, there's certainly no doubt that people with psychotic disorders are more likely to use cannabis than not. And one piece that's particularly concerning is that people with psychotic disorders tend to have an onset of cannabis use disorder that precedes the full diagnosis of schizophrenia. So it has the appearance of a causal effect. So you start using cannabis first, and then people develop psychosis. But there's an equally compelling argument that they're both manifestations of a similar problem, just the cannabis use comes first, because people tend to start using cannabis around 15, 16 years old and are more likely to have a psychotic incident around 18, 19 years old. So we see this appears to be a precedent, but it could just be an earlier manifestation of a larger syndrome. For instance, people who have psychotic disorders are much more likely to be engaged, to have educational problems, behavioral problems at school, even something like fire starting. at an early age. And we wouldn't say that those things later on cause the schizophrenia. So it's a tough one. But there's, I think, research on treating schizophrenia is unlikely to make a whole lot of progress by over-focusing on cannabis use. We need to see why these people who are at risk are using cannabis and what we can do to address whatever it is that the cannabis is doing with a way that is perhaps less risky.
Great, thank you. Just for interest of time, we'll just do one last question that has come in. So will the cannabis use impact the brain function through the long-term use for pain management for people with Parkinson's or dementia? So just talking about whether long-term use has any different from based on the duration that they take.
It does not appear so. The best evidence suggests that the cognitive, it's questionable whether there are very pronounced cognitive deficits that come from cannabis use, even acute use. And it looks like any type of modest deficit seems to reverse in about 72 hours. So there's no evidence that in people with Parkinson's or other neurodegenerative disorders, that cannabis use speeds the degeneration. Whether or not it's protective, as some people would like to hope, is not clear. But there's no evidence that it makes it worse.
Okay, great. Thank you. So that's all the time that we have today. So thank you so much, Zach, again, for sharing your expertise with us. And all of you for joining us today. Yeah, it was really.
If you have any questions,